In developing countries such as our own, cardiovascular diseases have usually surpassed cancer as the leading cause of death and morbidity. Now, in reference to the United Nations Declaration on Non-Communicable Diseases given in 2011, the World Health Organization has defined a target of lowering the likelihood of premature death from these non-communicable diseases such as cardiovascular conditions by 25% in 2025. However, the premature obstructive coronary artery disease has become a prime concern for patients, practitioners, and even policymakers in India. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I will be talking about the prevalence of risk factors and patterns of obstructive coronary artery disease in young Indians undergoing percutaneous coronary intervention. In a retrospective study, a group of Indian researchers, they aimed to explore the prevalence of risk factors and also evaluated the trends of this obstructive coronary artery disease in Indian females who are less than 45 years of age compared to their male counterparts of the same age group who underwent a percutaneous coronary intervention. Now, they conducted a retrospective observational multi-center study of young Indian females and males who underwent the PCI procedure as per the guidelines at 3 high-volume centers in India. Now, in this group of close to 3,700 patients under the age of 45 who had PCI, 3.1% of those who with obstructive coronary artery disease were young women, while 6.9% were young men. Traditional risk factors included hypertension, diabetes, and even a family history of premature coronary artery disease were equally common in both the genders, whereas dyslipidemia, overweight, smoking, and alcoholism were more common in the male population. The acute coronary syndrome was the most common clinical presentation in this group. The single vessel disease was also quite common, with the involvement of the left anterior descending artery as the most common angiographic feature. The prevalence of cardiogenic shock was 4.4 in the females and 4.1% in males, while the in-hospital mortality rate was 1.77% in young females and 2% in young males. The researchers therefore concluded that the obstructive coronary artery disease in young men and women accounted for close to 10% of all the coronary artery disease cases requiring a PCI intervention. Although men account for the majority of the patients, coronary artery disease in women under the age of 45 is still not uncommon. Traditional risk factors are becoming more prevalent in younger women, hence they need to take more precautions. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.